detailed performance management team, which includes a focus on client-level poverty measurement using the Progress Out of Poverty Index. Julie has worked in financial inclusion and at Grameen Foundation for more than 10 years. She's made a career switch into the international development sector after working in public accounting at KPMG, in finance at a technology consulting firm, and earning her MBA. She has had several different roles in her time at Grameen Foundation, and prior to joining the SPM team, she served at Grameen Foundation's County Director in the Philippines and managed a 4-year microsavings project there. She saw firsthand the power of poverty data in understanding usage and improvement of savings products for the poor. She's excited about how we can start using more data to drive better decision making that will improve expected outcomes and eventual impact on the lives of the poor. So without further ado, I'd like to present to you Julie Peachy.
Thank you, Arcelia, and hello everyone. I'm excited and happy to see so much interest from our Bankers Without Borders community in the PPI and using data to improve anti-poverty strategies. So this webinar today is kind of divided up into a couple sections. I'm first going to just give a general overview of the PPI and talk about a little bit about its history and how it evolved and where we are today, and then talk a little bit more broadly about how Grameen Foundation and others are using data in the development sector. Just a second. So first of all, we're going to talk about the problem, and this is the problem that the PPI has set out to solve, and that's that we need to measure poverty to be effective at ending poverty. I really believe that objective poverty data leads to smarter decision making among managers of microfinance institutions or social enterprises, any organization that's out there fighting poverty, and that this poverty data can hold an organization accountable to its mission. In our work with microfinance institutions, we've seen a lot of resistance to measuring poverty. We've heard managers say, oh, we know our clients are poor, but then when they actually started using the PPI, many of them found that that wasn't the case, and so they needed to be more deliberate in finding poorer clients, or maybe it was just in actually segmenting their clients sort of to understand the range of poverty amongst their different clients. I recently ran across a very interesting quote on a blog post by the Mixed Market about how 77% of microfinance institutions sort of state that part of their mission is to alleviate poverty, but only about 20% of them are actually measuring it. And that's the problem that the PPI has set out to help alleviate. But why do we need a tool to do this? Measuring income, which is essentially what the PPI does, it's a proxy for the income of a family, it's measuring that is actually really difficult in these informal economies that we work in because there's inconsistent income, people are holding different jobs, they have different income streams, they may be actually trading instead of using actual cash or currency to get paid, and they're not really keeping very adequate records of income. And so it's really, really difficult to get an accurate sense of income just by asking the family or by trying to use any records that exist. And so it's, again, difficult to know whether a family is particularly poor or whether that's changed over time. So the solution that we came up with is the Progress Out of Poverty Index. During our work over almost the last 2 decades, as I just mentioned, we saw that microfinance institutions in particular were struggling to understand enough about their customers. They couldn't do it even if they wanted to. And lenders, investors, and donors were also putting pressure on them to prove that they were achieving their missions. So we saw the need for a simple, cost-effective method that would allow MFIs and other organizations to measure the poverty level of their clients. So in 2005, almost 10 years ago, the Progress Out of Poverty Index, or what we now lovingly refer to as the PPI, was born. And that essentially enables an organization to estimate whether a certain household lives below recognized poverty lines. That could be $1.25 a day, $2.50 a day, or a country's national poverty line. And then on an aggregated basis, it allows an organization to estimate the overall rate of poverty of a group of people. So the PPI is a country-specific scorecard. It's developed actually based on a country's household income and expenditure survey. It's got 10 questions. It's actually been developed in close partnership with Mark Schreiner, who is the actual developer. He had started developing something that he called a simple poverty scorecard, and then we came alongside him and partnered in turning that into the PPI. Again, it has 10 questions. It can be completed by someone that's interviewing a person in their house in less than 10 minutes. And so for a field-based organization that has a lot of other things going on, it's actually quite easy to use, and it is reliable. And as I said before, it's tied to those international poverty lines, which allows for benchmarking across countries. So just a little bit more about how it actually works. Each one is developed by our economist, by Mark Schreiner, and he basically boils down the hundreds of questions on a country's household income and expenditure survey, which typically is done every 5 years or so by that country's National Statistics Office. And he boils, maybe there are probably 500 or so questions on each of those surveys. He boils those down to the 10 that prove to be the most highly correlated to poverty. It's really part art and part science. We often narrow it down to 20 different questions, and then we do a field test and a user review and try to make sure that those 10 questions are not only the most highly correlated to poverty, but also easy to ask, are easily verifiable if in observation at the home, and okay from a cultural perspective. Some cases there's a question on there like, is there a mattress in the home that that people on the ground will say, well, that's actually really not culturally acceptable to ask about. And we also try to make sure that the questions are likely to change, and that's important when we want to use the PPI, multiple records of a PPI on a person to measure change over time. And then there's a table that converts the scores. So once a score is gotten for a particular household, it gets converted using this lookup table that you can see here to basically come up with then the estimate of the likelihood that that person is under the particular poverty line. So again, the example circled here on the slide, if the score was 33 and you wanted to be using the $2.50 a day line, you could say that that household had a 42.6% likelihood of being below the $2.50 a day line. So essentially, for a household, gives you the percentage likelihood that that household is below the poverty line, and for a group, when you average those likelihoods, you would be able to say that, say, 55% of these households live below that poverty line. Right now, we actually have 55 PPIs developed, so that actually covers 90% of the world's population. And we're hoping over time to bump that up to about 95%. But right now, we're pretty pleased with that coverage. So the majority of the world's population living below the $1.25 is in a country where there is a PPI. Just a little bit, too, about who's using the PPI. Grameen Foundation started out working mostly in microfinance, but as our work has evolved, we've also pushed the PPI into other sectors, and now more than 230 organizations have confirmed that they're using the PPI, because it is out there as a public good. We're not entirely sure how many, and we think there are definitely more than that. But it's being used in other sectors as well, which we've been happy to see, and we've been promoting it especially in agriculture sector and by other types of social enterprises and livelihood organizations. And some bigger companies as well are using it. Multinational corporations like Unilever and Starbucks, impact investors like Root Capital are using it, health-based organizations like Marie Stopes. So it's really become a bit of a global standard in terms of poverty measurement. It's also being incorporated in many monitoring and evaluation frameworks. IRIS, which is done by the GIN, or the Global Impact Investing Network, points to the PPI as a tool for measuring poverty in their impact investing framework. The Mixed Market gathers that data and is able to report out on it. The Sustainable Food Lab and COSA are initiatives within the sustainable agriculture industry that include the PPI as a proxy for income in their metrics frameworks. And the list goes on. Just I'll share a little bit about how organizations use the PPI. There's actually multiple ways to use it and multiple objectives. The first one is simply just assessing whether an organization is achieving its anti-poverty goals. You want to find poor customers, you want to serve them, and make sure your products and services are benefiting them. So it can just essentially help you answer that question, am I any good? Am I achieving my mission of serving the poor? So for example, an organization may have set a goal that at least 60% of their customers should be poor, and they can easily evaluate whether they're meeting that target. Or if they've just designed a new product that was intended for a poor segment, they can see if it is actually appealing to that segment and taken up by poorer clients. And it's one thing to sort of just assess where you are at in terms of your poverty outreach, but it's another thing to try to improve it. And that's more and more what we are seeing and hoping to see with poverty data, as well as other types of data and metrics. And just as one example of that, the recent project that I worked on in the Philippines, we found that a new savings product that was designed specifically for a poor market was not getting very much traction. And so we lowered the opening balance requirement for that savings account, and we immediately saw a big spike in the account openings. And what we also saw by analyzing our PPI data was that there was an increase in the number of poorer customers who were opening the accounts, which that demonstrated that our product design and our pricing was improving from the perspective of the poor. And for example, if the finance department wanted to push back and say that the product wasn't doing as well from a financial standpoint because that opening balance was lower and not bringing as much cash into the organization, we had hard data to show that there was a real trade-off in favor of the social goals. Just a few more examples that I wanted to share about how other organizations are using the PPI. Friendship Bridge is a microfinance organization in Guatemala, and they use the PPI data to help validate their strategy, and it's actually influencing their strategy development for the next few years. They work a lot in agriculture and have specialized credit and education products, and they specifically decided to focus on agriculture because the PPI data showed that there were higher rates of poverty among those clients. So it really influenced the strategy of the organization. Another large international microfinance network, Opportunity International, is using the PPI. And in 2013, they studied the impact of their agricultural loan program in Uganda, Malawi, and Ghana. They actually used the PPI to measure change in client poverty between 2009 and 2012, and they compared those results to those belonging to non-clients for the same time period. This was a pretty big study. It included over 1,200 farmers. And what they found, and this is actually really hard to do, this sort of analysis of change over time in PPI scores, but what they found was actually quite encouraging, that their clients, who were farmers who'd had several loan cycles, were actually doing better than the non-clients that were studied. Now, it wasn't a real RCT with a real strong control group, but this was definitely some findings that gave Opportunity International optimism about what they were doing and how their program was being run. Another organization is actually a research organization that is using the PPI is Intermedia. They are a nonprofit that specializes in research and evaluation, and they had partnered with the Bill and Melinda Gates Foundation to manage a research program called the Financial Inclusion Insights. It's researched how people, especially the poor, make use of mobile money and other digital financial services. And that research began about a year ago. A lot of it's done and actually posted out on their website, and they have a bit of an open data platform where people can download the data and play around with it. They use the PPI in all 8 countries, simply adding the 10 questions to a larger survey, which is what we're seeing a lot of organizations do as they go out to do a larger baseline survey of a project. Just add the 10 PPI questions to that, and then you have your poverty data built into the baseline survey and results that you get. Grameen Foundation, a lot of what we do in our Social Performance Management Center is, in addition to actually developing and updating the PPI scorecards, is supporting users. There is a lot of demand for the PPI, but what we found over the last almost 10 years is that practitioners need quite a bit of support to accurately use the PPI and make the most out of their data. So we provide a good bit of training and resources. We have a website called progressoutofpoverty.org that has a lot of resources, and we also would provide support for an organization that wanted to implement the PPI, and provide advice also on mobile-enabled data collection through our TerraWorks tool. And the data analysis is probably one of the most important things. We get a lot of people saying, well, we have all this data now, what do we do with it? And so that's one of the things that we're really focusing on over the next couple of years. So now I'm going to move on to talk a little bit more about just using data, not just PPI data, in the development sector, and some things that our programs have been doing that we think are pushing the envelope a bit. Compared to the private sector, when you look at what we in international development sector are doing with data and how we might be using it to improve the lives of the poor, we're really lagging behind. Fairly recently, we talked with many international development organizations about how they're using data to manage and monitor their programs. And what you see on the screen is what we heard. When we are using data, it's been largely as an accounting function, not really using the data to improve our programs in real time, to educate ourselves about the lives of the people we are trying to engage, or to deliver any types of customized services. So our vision for the sector is that we would start using more real-time or just more updated data to improve the lives of the people we serve, the same way that big retailers, here in the U.S. and other parts of the world, like Amazon and Home Depot, are using data to improve our experiences as consumers. And so what gets me really excited about my work in social performance management is the vision that someday we have the same deep, rich understanding of the behaviors of the poor as big companies here in sort of the more developed world are already able to do. So just a little bit, it's a pretty grand vision sort of to get to that point. And so I'll share a little bit about what Grameen Foundation has been doing and learning with client-level data over the past few years as we have built and used mobile technology platforms for our work. I think people are pretty familiar, a lot of people are pretty familiar with our work in microfinance, and that's a lot of where we started out. But not as many people know about the technology aspect of what we've been doing over the past 10 years or so. We've actually built a robust yet simple and user-friendly mobile platform that is agnostic to content, which allows us to adapt that platform to each of the different interventions that we're working on. So we've used this for our financial services work, for mobile franchising, for mobile health programs, and in our agriculture work. And I'm going to be talking now about some examples from our mobile agriculture work in Uganda and Colombia. One of our projects in Colombia is in partnership with Starbucks and a coffee cooperative. The objective of this project is to empower smallholder farmers, smallholder coffee producers, to improve the quality and productivity of their product and facilitate their potential to sell it at higher prices by connecting them more fully to the value chain. And we envision, the whole purpose of sort of doing this is that the smallholder farmer can be seen as a reliable and skilled and preferred actor in markets with sufficient capabilities and resources required to run a profitable business, attract investment, benefit from the market ecosystem, et cetera, all in order to improve their livelihoods. But in order to do that, we need data. Our work in Colombia evolved out of our original Community Knowledge Worker, or CKW program in Uganda. That program provides agricultural information to rural subsistence farmers in the most rural and remote parts of Uganda. We identify people to serve as community knowledge workers, and these CKWs are usually themselves subsistence farmers who live in the community. They're trained to use an Android phone that has a database of agricultural information. They're assigned an 8 by 10 mile area, and they walk around providing information services to local farmers. Because they're using a mobile phone, we can collect a wealth of data about each farmer and each interaction, including which CKW provided the service, the GPS location of the interaction, what questions were asked by the farmer, etc. Through this program, we found that mobile phones were a highly appropriate and effective tool for reaching more farmers in remote areas with far greater frequency than is possible via traditional agricultural extension services. We also saw that the effectiveness of using the same channel to capture farmer information and feedback on a regular basis. And we've since built the majority of our work around this two-way information flow via the mobile phone, and also created a product that I mentioned before called TerraWorks that enables others to do this same thing. That mobile channel reduces the data collection challenge, as much of the data is an inherent part of the registration and service provided to the farmers. So in our Colombia project, we have socioeconomic data, poverty and food security data, information about the farmers' attitudes, finances, what agriculture practices and co-op services they use, details about their farms. We have a lot of data on these farmers. So the technology that we use is our TerraWorks platform, which uses Android devices on the front end and the Salesforce database on the back end. Our Colombia Coffee Cooperative project has more than 1,000 coffee farmers registered in the system. And the extremely robust dashboards in Salesforce are updated real time. And this is an example here on the screen of that dashboard, one of the dashboards that we have built in Salesforce. We don't have any more static point-in-time reports that are instantly out of date. Here in this example, we can see information about the age and gender of the farmers, their education levels, their poverty levels, and we can identify which characteristics the coffee producers have in common. So we can slice and dice these numbers in all sorts of ways, but what do we do with all of this? Part of it is having a full profile of each farmer. It's turning this unknown group of 1,000 farmers into individuals with unique needs. And as we work with them on improving their agricultural practices and productivity, we can share this data back with them. So there is value in the data to us, the co-op, and other actors in the supply chain, but there's also value to the farmer. And that is often what's not happening when data is being used. That data is not being fed back to the farmer, or the person whose data has been pulled out is not benefiting back to that person. But with all of this and this farmer profile information, after doing an evaluation of each category of best agricultural practices that the farmer is using, we can sit down and show him his results. How efficient is he or she? Then make an individualized farm management plan for the farmer that helps him or her decide and follow up on practices that they might want to improve and that will help them get certified. We can also come back and see which farmers decided to work on which areas, like whether they decided to work on erosion problems or getting better equipment or managing diseases, and how that impacted productivity. One of the questions our project team was asking is whether coffee is a viable business for these farmers, and if so, under what conditions. From the data that they collected on all these farmers, they know that the average farmer has 3.94 members in the house. We also calculated that it requires 3.38 hectares of land and production of about 1,800 kilos in order to achieve an income equivalent to the national poverty line in Colombia. So looking at the averages, it appears that only 30% are meeting the minimum requirements to get out of poverty. But that's just looking at averages, and in order to really understand this, we needed to segment the farmers and dig a little bit deeper. So next, we segmented the farmers into 4 groups based on their likelihoods of being poor using the PPI. The segments range from most likely to be poor on the left to least likely to be poor on the right. And we saw something surprising, that the poorest segments had higher productivity than the other segments, and the least poor actually had the lower productivity. So there was no correlation between poverty and productivity. But is coffee a viable business for that poorest segment? Would it produce enough income to lift them out of poverty? Those are other questions that we continue to ask. So in order to figure out at which point coffee could be a viable business for each segment, we built out a statistical model to figure the break-even point. How much coffee-producing land area do they need to own, and how productive do they need to be in order to get out of poverty, based on their family size and other variables. We found that 20% of the farmers are living in poverty and not likely to get out of poverty by just farming coffee. That's the 188 that we found needed about 5,000 kilos more in productivity to get out of poverty. That was a huge shock to Starbucks, who until just a month or two ago when these results came out, thought that they were doing well with 100% of their coffee purchasing meeting their own ethical sourcing standards. But if 20% of the farmers are in poverty and not likely to make it out on coffee alone, then that's not really so ethical. So now that we in Starbucks know this about that 20%, we're working on figuring out a different strategy for those farmers. Perhaps the focus on crop diversification instead of just being more productive with coffee. We wanted to see what contributed to some of the farmers being more productive. So we partnered with Palantir, which is an extremely advanced data management company based in California. It was started by the founder of PayPal, and they have an incredibly powerful data analytics system. Their specialty is being able to layer completely unrelated data sources on top of each other and find patterns. And here's a dashboard from their system looking at the impact of 2 variables on the productivity of the farmer, whether they use a method for preventing disease or whether they treat diseases on their crop. The data shows that the farmers who are both treating and preventing are producing 44% more than those who aren't doing either. So you could say it's logical that they would be more productive when using methods for disease control, and we could simply encourage them to do this. But there are 5 primary diseases in coffee in Colombia, and it's expensive and time-consuming to do this disease control. So is it possible to focus on the treatment and prevention of just one disease to make it more manageable and get the biggest return for the money? We created heat maps of the farms with different diseases so we could see how widespread each was. This is a heat map of the farms that have a problem with coffee rust. It's the most prevalent disease, which you can see. The yellow dots there are the ones that the farms that have the problem with coffee rust. Now we can confidently suggest that limited resources should be put into preventing and treating that disease. If they focus on that, it's going to take care of a lot of the problem. So just to see quickly what else we can do with these heat maps, here's an overlay of farms with coffee rust and the farmer's poverty likelihood. And since coffee rust is so prevalent, there's actually no outstanding correlation between that and poverty levels. But this is an example, and with some other variable, there might be something to explore in correlation with poverty. And I'm almost done. I know I'm running a little bit behind schedule, but just to follow on with the heat maps, it's probably most valuable to be able to see changes over time on the maps. One of the first projects we worked on with Palantir was with all of our CKW data in Uganda. After they pulled all of this data into their system and we played around with it, we noticed something pretty interesting. By looking at the questions farmers asked about particular crop and animal diseases, we could watch and see how those diseases spread across the country over time. And in several cases, we could pinpoint the ground zero of those outbreaks. That gives us a lot more to think about and analyze. Do outbreaks spread across Uganda in similar ways? Can we predict how they'll spread? Is there a certain tipping point or threshold after which a disease will turn into a countrywide breakout? Are there ways we can work with the Ministry of Agriculture and alert them to potential outbreaks of a particularly bad disease so they can intervene early? So these are some examples of the things that, some of the interesting things that we've done that's helping our team and partners understand if their work is making a difference and how we might change things. What gets me excited about all this work is the potential that it has if all of us also start sharing the data that we're collecting. All of us, I guess, in the international development sector. We actually have, in Uganda alone, 1.5 million program interactions, all linked to unique farmers. And that's just a little bit of our clients' lives. And so at Grameen Foundation, we think about, what if we took all that data and fused it with data from other organizations working, say, in water and sanitation, or from other financial inclusion organizations, health organizations, and kind of put all that data together to have a richer 360-degree sort of profile or understanding of our clients, and just truly have like visibility into their lives and behaviors in order to develop the services and programs that would lift them out of poverty. So that is what I have for today, and I'm eager to hear any of your questions, and hopefully we have time to talk a bit.
Thank you so much, Julie, for that presentation. It was very informative, and I'm happy to say that we have a ton of questions for you.
Oh, great.
So that means that our audience was very, entertained and very excited to hear you talk about this. So that's all great. So what I'm going to do is I'm just going to go down the list of questions here, give you some time to answer them, and we'll try to get through as many as we can, given our time here. But to anyone in our audience, if we don't get to your question, please feel free to reach out to me individually, or I can reach out to you to find, to give you the answer to your question. So we'll try our best to get through as many as possible. So one of our first questions here is, have you considered opening up a platform for all organizations using the PPI in order to create a larger community of practice?
That is something that we're looking at. I mean, one of the things that we're right now really focused on is figuring out the long-term kind of business model for the PPI. And one of our ideas is to create something like a shared resources center where we would pull together other measurement tools and resources into one, sort of, as you might call it, a platform. So practitioners on the ground could really easily access the tools that they need to do this work. I think one thing that distinguishes what Grameen Foundation's focus is on and the PPI is that we're really trying to make it fairly easy and simple so that an organization on the ground, an NGO without a lot of resources, without PhDs, can actually use these tools and get the data that they need and want to improve their work.
Thank you. So here's another question. How does the PPI compare to the MPI, the Multidimensional Poverty Index? And if companies are not using the same poverty measuring tools, how do you obtain accurate data for a specific region?
So for the first part of it, in the comparison to Oxford's Multidimensional Poverty Index, PPI is, I think you could call it complementary. It's a bit different in that the PPI is primarily focused on financial poverty, and the Multidimensional Poverty Index includes other aspects of poverty, like a focus on education and health and other aspects, not just the sort of financial or income-based aspects of poverty, which is great, and there's a lot of people talking about that. I think the one difference is that in order to do that and use their tool, it's a bit more complex and time-consuming, so not as practical for, say, a microfinance organization to use it themselves on an ongoing basis. And what was the second part of the question?
Sure. If companies are not using the same poverty measuring tools, how do you obtain accurate data for that region?
So, I mean, certainly if one organization on its own is doing this, they should use the same tool across different countries. It is a challenge, I think, when organizations use different tools and methodologies, but at least the point of the PPI is to have a standard, and you probably couldn't compare it to other to data, say, that's been used or calculated using the PAT, which is another poverty measurement tool, but as long as it's related to international poverty lines, you can compare against other countries. Great.
Here's another question. How does Grameen Foundation approach companies like Starbucks and a few others that you've mentioned to engage them in this kind of social performance and this data collection, or does it work the other way around?
It happens both ways. We are part of, we work closely with an organization called the Sustainable Food Lab, and they work with some of these bigger private sector companies like Starbucks and Unilever and Mars. So it's through partnerships that we have interaction, and it's kind of through this, the Sustainable Food Lab has a performance measurement working group that has evaluated the PPI and has done some different tests, and so the companies in that group are many of them are now using the PPI. So it's these working groups. We actually have what we call a community of practice in using the PPI in ag amongst those companies. But it's a combination of things. Sometimes they reach out to us. They've heard about the PPI somehow, and they want to work with us. In this case, in Colombia, I think through networking and partnerships, the project with Starbucks and the Coffee Cooperative came together.
Great. Here's another question from our audience. How does the PPI manage large shocks like drought or war in a specific area that may seriously complicate the efforts to measure impact and to collect data?
Yeah, that's actually a really good and difficult question. Amongst ourselves, we've talked about, whether it's even ethical to use the PPI or try to collect the PPI in conflict zones now. Because, for example, we wouldn't want to send someone into a conflict area, just to knock on someone's door and try to get their PPI. So it's a bit difficult in that situation. What we're exploring is using alternative data collection methodologies, which would allow us to collect via SMS or interactive voice response. And that could solve the challenge just in accessibility of folks living in a conflict or war zone. More environmental hazards like a drought. I mean, certainly there are things that can affect what's going on in the country and that can change, say the results of the living standards in that country, and that's why the PPI scorecards need to get updated every few years, or at least whenever a country issues does a new household income and expenditure survey. Because as the economic conditions in our country are changing, the PPI questions need to get updated as well.
Great. I have another listener here who has kind of a little question, but I'll give you some background. It says, I've been working with MFIs in Peru where there is no money for surveys, for example, people in pools, in order to measure poverty and other characteristics. Do you know how they may be able to get help like this?
A lot of times the National Association or the Microfinance Network in a country can help an MFI with their PPI implementation. When we first launched the PPI, Grameen Foundation ourselves were actively going around and promoting the tool and helping users to pilot or implement it. Right now, we're not focused on doing that. We've focused on kind of leveraging, training others to do the same, and in a lot of cases that has been the country microfinance network or some other kind of global microfinance network like Opportunity International or Vision Fund. If they're not connected to one of those, it is a challenge, and that's something that we're trying to address in, I guess, in sort of an advocacy way of with all the donors and other international organizations that we talk to, is just emphasizing the need for funding and support for social enterprises and microfinance institutions to be able to do this work themselves. It's a real challenge because all this M&E and data collection and use is really important, but we find that not a lot of people want to pay for it. Even the impact investors that are asking for all this data from organizations they invest in aren't providing the resources for the organization to do it.
And Julie, do you know of any tools similar to the PPI or the PPI that may be available for this type of data collection inside the United States?
I'm not positive. There is the PAT that was developed by USAID, but I don't know if they have a scorecard for the U.S. or not. I'd have to look into that. So off the top of my head, it's a very good question. We've considered over time whether we should create a scorecard for the U.S., but we haven't done that yet.
Great. I have another question here. It says, how often should organizations collect this data through the PPI in order to compare it over the years?
Mm-hmm. We suggest probably having the PPI data collected probably at every few years in order to look at progress, sort of compare points over time. Every year is a little bit too frequent. although that is what we recommend MFIs do in a lot of cases if it's built into their operations. So there's a couple things to consider, but one is if it's embedded in the operations, like a microfinance institution would just include the PPI as part of the loan renewal process or loan initiation process, they can just easily get that data and have it on hand. And so in that case, like having, frequent records like every year or so certainly doesn't hurt, and it's the benefit of having it embedded in a process is better. But if you're looking at change over time, it does take a while for those indicators, the questions on the scorecard to change. And so probably looking at them over a period of 3 to 5 years is more ideal.
Great. I have a question here that kind of goes back to one of the slides of your presentation. It says, what factors did you need in order to figure out what viable business size was for the Colombian coffee farmers?
I'll just go back to that slide, actually. So I think this is the one we were talking about here. We took the national poverty line income per household member and calculated how much they were producing today using the average price of the last crop cycle, and we estimated the income based on an assumption of 20 to 30% profit. So we figured out how that translates into a sort of dollar per family member per day, and then we figured out how much income per family member per day was needed to get them above the poverty line. So it was a bit of a complicated process. I hope that made sense. I hope that answered the question.
Another question here from one of our audience members. What opportunities exist for data analytics professionals and entrepreneurs in the development sector?
Ooh, there are lots of opportunities these days. I'm getting a little echo. Maybe. Okay, I think it's on now. Yeah, maybe Arcelia, can you mute? There is a lot of talk about big data in the international development industry, and I've recently just been at several conferences that are focused on M&E and big data and using technology and doing the data analytics work. In terms of specific opportunities, I think one way is, in getting into it, is to join up with an organization like DataKind, or that is kind of taking volunteers and using using volunteers to solve certain problems, and then that is a good foot in the door and networking. But we could follow up with some specific resources or links if you're interested.
Thanks, Julie. Another question here is, how often are these scorecards updated?
We try to update each PPI as soon after a country does another income and expenditure survey, although it typically doesn't happen right away, and we're also dependent on having the funding for that. So on average, they're probably updated between every 5 to 10 years. It does a lot of the work that's involved in creating and updating the PPIs is just being able to get the data from those household surveys and the enumerator manuals and all that's needed to create the PPI from the country's National Statistics Office. It takes a long time sometimes to get all of that data, so there's a lot of factors that play into when and how we can get the PPI updated.
Great. It looks like we have time for another question, maybe two. So how do you decide which households to use the PPI tools on in terms of how to collect the data? Do you go door to door, or do you collect only a sample per region? How do you ensure that you have an accurate picture?
Good question. Depends on the type of organization. So if it's a microfinance institution, they might choose to either sample their group of clients, and we have some guides on our, I'll actually just forward to, oopsie, the last slide here, just a second, which is which is pointing to our website and all the learning materials that we have there. So there's a sampling guide here that an organization can use to calculate the sample that would be representative and give an accurate picture, or they can embed it in their operations and do what we call a census approach and essentially survey everyone. And it's easier in the microfinance model because there's typically a loan officer that's visiting the client's home fairly frequently or on a regular basis. And so they can, when they're visiting the client at their home, just do the PPI. With other types of social enterprises, it's a bit more difficult and maybe more costly to go to the client's home and do the survey. In that case, they can do a sample as well using resources in our sampling guide. They can choose to do all of their customers or just a group of customers. But more and more, since different types of organizations are using the PPI, we are exploring these different data collection methodologies. And organizations have tried collecting the 10 questions via SMS. There's some challenges with that, like low response rate and a slight decrease or a difference in the responses compared to when it's been taken in the home. There's also been some testing it out using a call center. There's actually a really interesting case study about an ambulance company in India that collected the PPI data via a call center and found that it was quite accurate, and that was a good way of doing things. But we're in the process of doing a more rigorous test on different collection methodologies, so we can, with confidence, recommend using those and and still have the same accuracy. But there are a lot of ways, and we do have the PPI standards of use, which are recommendations or best practices for how to ensure that the data that is collected is accurate, because that is a real challenge. There's a lot of places in the process where errors can come in, and so making sure that the data is accurate is extremely critical. And that's also why we have our PPI certification program. So organizations can be assured, or like an investor could be assured, that a particular organization is using it in accordance with our standards of use.
Thanks, Julie. And one last question here. For organizations that are looking to start using the PPI, what kind of costs are involved up front and ongoing?
It really depends on the size of the organization and what kind of organization it is. Again, the tool itself is free to download, so there's no cost to that. They'd probably want to invest in a bit of training as they start to pilot and implement that. And if they, came to Grameen Foundation for that, it would cost a few $1,000s. They'd need to invest in some training their staff and enumerators. So there's a little bit of time and money invested there. The paper is part of it, or however they want to do data collection. If they already have used or want to go to a mobile-enabled data collection methodology, there's cost there, but that would probably not be different from other data that they're collecting. So it depends on how deeply they implement it. there is a cost, and that's important to recognize, but compared to other methodologies, it's fairly low cost.
Well, I think that's all we have time for today. So I want to take a moment and thank Julie for her presentation today, which was very, very useful. I'd like to thank the audience for joining us and for having these wonderful questions. I am aware that we didn't get through all of the questions today, so I will do my best to answer those offline. So some of you might be hearing back from me to answer your questions. For those on the call, I'd like to just reiterate that our webinar is being recorded today. So this will be made available for all of you. You'll be able to find it on our Bankers Without Borders website. That's www.bankerswithoutborders.com. You'll be able to find it under our blog section there. And for anyone on the call who's a Bankers Without Borders volunteer, you can also find it on the volunteer portal. Feel free to contact me directly if you have any questions. My email is acardenas@grameenfoundation.org. Thank you everyone for your time today, and we look forward to seeing you at our next webinar.
Thanks. Bye.
Thanks. Bye.